A first of its kind 150 million Singapore dollar study over the next 5 years will examine how growing up in Singapore shapes the health and development of young people. Researchers will study factors such as mental health and digital habits, with findings expected to inform future youth policies and clinical guidelines. Sabrina Ng reports.
Children with their eyes glued to screens are becoming an increasingly common sight. But little is known about how growing up in a digital world shapes their development. That's one of the questions Singapore's Public Sector Research and Development Agency hopes to answer.
Many previous studies, both here in Singapore and abroad, have been focusing on one aspect of adolescent health. Let's say, for example, mental well-being only. We would also like to look at physical health, overweight and obesity, social factors. So we are doing it in the most holistic way that we can think of.
Researchers hope that by bringing together data from several long-term studies, the findings could help shape future health, education and community policies and support programs that can be rolled out more widely.
We are working very closely with the relevant stakeholders. So a potential change will be in, for example, increasing access to sports facilities, to green spaces or open spaces, to increase the levels of social interaction, physical activity among the young. So this will also channel maybe more of their attention towards outdoor spaces and away from digital media use.
Around 5,000 adolescents aged between 10 and 24 years old will take part in the study. A-STAR will work with the Education Ministry and other research and public sector partners. Researchers will track and interview participants over time. They will use the findings to identify and test solutions that work in Singapore.
Why is a study on youth important? Researchers say adolescence is a crucial stage of life. What happens during these years can shape a person's physical health, mental well-being and even productivity later in life. So researchers say supporting adolescents now is also an investment in society's future. Researchers define adolescence as a period from 10 to 24 years old. It is considered the second major window of development after the first 1,000 days of life. This is when the body and brain change rapidly as young people form their identities, build relationships and prepare for adulthood. The program will look at many factors shaping adolescent health and development. These include sleep, nutrition, exercise and mental health, as well as relationships with family and friends. We'll also study digital habits, early childhood experiences, and how the urban environment affects young people's well-being. And as to why Singapore has to do its own research now, much of what we know about adolescence comes from studies of Western populations. But those findings may not fully reflect the experiences of young people in Asia. Singapore also offers a distinctive setting with its diverse population, strong family networks and highly digitalized environment. And researchers hope that this will produce findings that are more relevant to local and regional needs. And for more on this, we have two experts from A-STAR Institute for Human Development and Potential. Professor Johan Eriksson is Executive Director and Dr. Desiree Phua is a Senior Scientist. Now, Professor, let's start off with you first. Why does Singapore need a study like this now? What's changed?
I'm not sure if anything has really changed. Singapore needs to study, but globally, this is also a study that's certainly needed because there are very few studies focusing in a holistic way on adolescent health. Because most of the previous studies have been focused on one specific aspect. We are really trying to focus on all aspects in relation to health that are important. The environment, social factors, biological factors, as well as the digital world. And another important point is that the world has changed very rapidly after the COVID pandemic. And there are no studies available really looking at what the world looks like today.
Professor, a lot of what we know about adolescence comes from studies overseas. So why is it important to have Singapore-specific and Asian data?
I think it's really important if we want to make conclusions and policy recommendations. They should be based on studies done here in Singapore because there are cultural differences, there are social differences. For example, if we think about the family ties in Singapore are much, much stronger than in most Western societies. The role of grandparents is much more important here in Singapore compared to Western societies. But also, Singapore is a highly competitive society, much more competitive than many, many Western societies. And we need to take all these factors into account when we come up with recommendations.
Now, Dr. Phua, let's bring you into this conversation. Digital habits are a big focus of this study. What are you hoping to understand that we don't already know?
There are indeed many things about digital behavior that we do already know, but we don't know the details, such as the how, the when, and the why. What do I mean? Digital use is very broad. It ranges from WhatsApp and Telegram channels to Instagram to TikTok, Be Real apps, YouTube, mobile games, Discord, and many others. Are there different profiles of use? Do certain type of use, are they more susceptible to problematic use and hence lead to adverse outcomes? If yes, why? And how are the teenagers using these platforms? What needs of the teenager are they serving or are they meeting? Are the effects of all this platform equally bad for all teenagers, or it depends on other factors such as the age, maybe? So there are actually many deeper questions about digital use that we actually need to answer.
Dr. Phua, as we know, AI is becoming increasingly embedded in young people's daily lives. What would the new research initiative be exploring about AI's impact on adolescents?
At the very first level, we definitely want to know the prevalence of AI use among the adolescents. How much are they using AI? What type of AI? For what purpose are they using AI for? And then we move on, right, to how does AI affect learning and well-being. I'm not just talking about intellectual or academic learning, but also social emotional learning. Again, are these effects equal among all adolescents, or are there actually other factors that actually impact how much what's the implication of AI on the adolescents' well-being and or their learning? And of course, then the question is why? Why do they have all these implications? Why are there all these impact taking place? When it comes to learning, is it really just because it's taking the easy way out of learning, or is there something more, right? And how does AI then affect their perception of themselves and of the world, especially in this period where they are actually asking the question of who am I? Why is the world like? Where do I belong in this new reality, right? So the one big question is, how is AI, coming into this conversation that they are having and these questions that they're seeking answers for. So it's really not just about finding out what is happening, right? But also the why, and the how and for whom. If there's a particular type of or particular groups of adolescents that we should be focusing on, the impacts may be different, the effects may be different. We are just not sure. So again, it's just taking a deeper look into AI. It's not just about how or how much they're using, but again, the mechanism and the processes that's actually involved in all this when they use AI.
Professor Erickson, this is a 5-year longitudinal study following the same young people over time. Why is that approach so valuable, and is 5 years enough to uncover meaningful insights?
First of all, I believe that 5 years is certainly not enough. But we are fortunate in such a way that in some of the studies included in this program, for example, in Gusto, we have already been following the children for 16 years. So we have the possibility in total to follow them for up to 20 years, which is a really, really long follow-up time. Why do we need to do longitudinal studies? If you just do a cross-sectional study, you can compare it to a snapshot of this individual. We know what this individual looks like, how he or she feels at that moment, but we have no idea about the background factors, how his development has been. So a longitudinal study can really give us insight, because if we think about potential interventions, for example, if somebody is not feeling well at the time of adolescence, the reason for this might be found much, much earlier in life. And this is something we can only learn from a longitudinal study.
And a question for both of you very quickly. Maybe Professor first. When people hear research study, they may think surveys and questionnaires. What will participation actually involve for these young people and their families?
It's very much questionnaires, very much surveys, but we're also going to draw biological samples, blood. We are going to do imaging studies, for example, of both the brain and the body, like I mentioned before, to get the most holistic picture of these young people. We're also going to interview the parents, so we would get the whole family's version of the health of the young people.
And Dr. Phua, what will participants expect from this research?
I think in addition to what the prof has said, I think it's also cognitive tests as well. Sometimes we are testing out the way they process information, the way they perceive information. So it can come in the form of cognitive tests, or some people just kind of describe it as just very simple computer games. Yeah.
Well, thank you very much for those insights, Professor Johan Eriksson, Executive Director, and Dr. Desiree Phua, Senior Scientist at A** IHDP. Thank you very much.